Hi, this is Tom Broussard. We're talking today about what we've been working on for quite a while is looking at hospitals in terms of what they do or don't do about um, aphasia on their website. Sorry about moving that around. And the so what we're building this database of about 2,500 hospitals around the country, and for the last couple of months, looking at in particularly 129 hospitals um, spread across 11 states, looking at those hospitals. The first steps to see if they have anything in their website. There's a lot more information that needs to be accrued, but it's difficult. You have to find the SLPs who work there, the stroke coordinators who work there, or people that have aphasia who are in the area who are aware that we are working on this. But anyway, for the first step was these 125 hospitals, and of course, what we're trying to do is build a team of people with aphasia, the SLPs who help us, and stroke coordinators, which are very important yet very well not known by the people other than the stroke world at the hospitals and the Joint Commission. So we're trying to build that together. And I say every once in a while, but yes, more and more, we're finding more people that are stroke coordinators. And those that we do find are typically want to do more to help about aphasia because they too realize that not a lot of people know a whole lot about aphasia, as we all know. Um, the But these particular hospitals now, as this particular study, really lets people see what's missing. And that is, of course, that the hospitals are really, really good at what they do. And I continue to tell my customers, the hospitals, that we're not trying to press you in any way at all. I just know how hard it is for you to do what you do already. But what we are trying to do is come up with additional tools that if you do some of these things without more staff, without trying to find staff, which I know is incredibly difficult, is to put materials into the structure so that if you have it on their website and if you do have materials, then you put that on the discharge list so that when people are discharged with stroke and aphasia, that they can get these materials every single time. So that's what we're working on here. But looking at the states, and here's a good shorthand example, but you'll be able to get the article on the website soon. Out of the 129 states, 54 states have no information in their website, none, zip, zero. So that's one. And all of these hospitals are stroke-centered hospitals. So they're either primary or comprehensive or some of the other designations. But when I say no, that means no. And that what that also means is that if you are discharging 1,000 patients that year, between 25 to 40%, so 250 to 400 people also have aphasia. Yet your own patients are leaving without knowing anything about it. And that's not to say that they haven't been assessed as an SLP, but that's what they're doing, is doing the assessment. There's no opportunity to do the treatment other than hopefully get them ready to go on to a rehab facility after discharge. But often that too takes 3 to 6 months waiting at home with no information. And that is the problem. Because if the hospitals can provide information at discharge, then the people with aphasia can use the wait time after discharge and before getting admitted to any rehab facility. It gives them the wait time to begin to understand that there are any number of activities that can be used that are self-directed, but repetitive language activities that are still highly therapeutic. And you can start doing that on your own. So that's what we're working for. And for 54 hospitals with no information, that's not a good thing. 58 hospitals have very little about aphasia. And what we mean there is that there are often, if you put in aphasia, they'll have articles, often to do with Bruce Willis, sometimes with John Fetterman, sometimes with other people. But there's no explanation of it. There's no saying what is aphasia or having definitions. It's really it gets you started understanding that there's this word aphasia, but you'd have to do a lot of work to find your way to something else. So that's what I say, the little or none. So 112 hospitals have a little or no information about aphasia out of 129. It's going to take us a couple more months to track down another 100, 150, 200 hospitals as we move forward. The 129 is 5% of the population of these stroke-centered hospitals. So we'd like to get more and more so all of us can get a better empirical understanding that, yes, there are hundreds and hundreds of hospitals who provide no information about aphasia, even though they have people in their facilities with hundreds and hundreds of people with that language disorder, but not helping us understand it. There are 17 hospitals that we listed as good. One in particular is a good example. When I say good, it means they do have definitions of aphasia and some links to other organizations with aphasia. So this particular hospital, what right now we call it the best hospital so far, has links to aphasia clinic, health library, a community page with aphasia groups, stories, articles about aphasia. One page that says, what is aphasia? Several pages at that point, providing explanations, causes, symptoms, treatment, recovery, all of that. And also provides links to the American Heart Association, American Stroke Association, and the National Aphasia Association. So that is a good hospital. For whatever reason, they probably over time, probably with leadership at that hospital, realized that such a huge component of people with stroke and also have aphasia, that they decided to start providing information in their website. But if there's just one of those, there's really only one, we need thousands of them to change. And I know you've heard me saying this before. If we just have a couple hospitals and the thousands of people who actually have thousands of patients who have aphasia but don't provide any information at the hospital or at discharge, that is not good. We have to keep working on that. And it is why I refer to all of this as more of a relay race than a sprint, although the hospitals are very good at sprinting, because that's what they have to do. That's what they have to do. It's as fast as they can to get to the patients and to do the treatment to keep the person with stroke to be even more severe. But there's a component of being the stroke people who also have to have a relay race component, and basically constructing an educational baton that can be passed on to their own patients. Even if you, meaning the hospital, doesn't have staff, can't do the training, there's just not enough time. I understand all of that. With some amount of work, not a whole lot, for the IT people to put into their website more information about aphasia, you can actually just copy and paste it from other places. And I know hospitals can't cut and paste anything that way, but an awful lot of information can be put together and put in there fairly quickly, so that the at least at discharge, if nothing else, give that information to them when they leave and make that part of the discharge checklist. And as I've said before, because it's still incredibly difficult to find the information online by looking here, by looking there, by finding one thing or another. That's why I wrote the ABCs of aphasia. That should be at every hospital in the country so that they have that to give. Then they have something that can't be thrown away, because this won't be thrown away. This is needed. And I know at the very beginning, it's the person with aphasia can't do it on their own. Hopefully they have family and other support friends who can help with the ABCs of aphasia, but everything you need is in that book, and there is no other book like this. So we have to keep pushing to make sure that the wait time is used with the materials we need. And that means that the hospitals have to realize that they really are part of this relay race, providing that baton that can be given to the person now with aphasia. Obviously, it's a relay race, but it's even more than that. It's a marathon for people with aphasia to get better and continue to get better for the rest of our lives. But in this metaphor of the relay race, at least get them discharged with the baton as they take their next leg. Thank you very much. We need to keep pushing on this. Call me if you need, send me an email. We have to keep pushing on this because I think that the hospitals are the start of it all. You can't just have hospitals who are discharging people with aphasia. Nobody knows about it. It takes years to figure all this out on your own, if at all. So this is what Aphasia Nation is trying to do. And again, there are millions of people with aphasia. There are a couple thousand hospitals in this country. There are a ton of SLPs and a couple thousand stroke coordinators. We need to put all that together and have basically everybody agreeing, you are right. We have to have every hospital have pages like you do with this one particular hospital that says, what is aphasia, and provide us with all that information, plus provide the ABCs of aphasia, because that can't be found anywhere else. Thanks again. It's nice to see everybody, and I will see you soon. Take care of yourselves. Take care. Bye-bye.